So many of us right now are thinking about that parasitic outbreak that's causing some explosive symptoms. It's called Cyclosporiasis, and the CDC suspects there are about 5,000 cases out there right now. For context, the U.S. typically sees around 3,000 to 4,000 cases of this illness in an entire year. Now, the number of cases fairly low right now in Minnesota, but the outbreak doesn't seem to be slowing down. We have our KSTP health expert joining us, Dr. Archelle Georgiou, right now with a look at what we need to know. Archelle, first of all, for those who aren't familiar, let's talk about what this parasite is and those disturbing symptoms.
Sure. So a parasite is different than a bacteria or a virus. It's a different type of organism, and it feeds on its host, on the human that it infects. So cyclosporiasis is spread through contaminated food and water, and it causes an explosive, watery diarrhea. Other associated symptoms are bloating, cramps, gas. Here's the good news, is that there is, for documented, for verified cases of somebody has it, antibiotics. It's called trimethoprim sulfa. It's a sulfa-based antibiotic that's easy to take, very accessible. Some more good news is that it's not generally contagious between people, and it's rarely deadly. You can get very dehydrated, so you want to prevent that from happening, but it doesn't have a high mortality rate. Of the 5,000 cases, there have only been about 141 that have been hospitalized. That's just about 3%.
Okay, Archelle, bringing us some good news. I like that. Let's talk about where this contamination started, and there's still a little question mark around that.
Lots of question marks, so it's unclear, and for a few reasons. One is that we have fewer resources that are investigating these sorts of outbreaks, but also this is a parasite whose symptoms take about a week or two to show up, and so investigations, public health investigations, will ask people, well, what did you eat yesterday? But in this case, they have to ask people what they ate a week ago or 2 weeks ago. Who remembered that? So it's really hard to track down. Two possibilities. One is that there was contaminated water on farms, in irrigation, in the soil, or in the processing plants. And then there has been some speculation that maybe there's something going on at Taco Bell. I do not want to imply that they are the source, but Taco Bell has voluntarily removed some ingredients to make sure that they're not spreading it further.
Yes, I've heard Taco Bell discussed and a couple of other items people are talking about, but with these question marks still sitting out there, Archelle, what foods should we be avoiding, or what are some other things we can do?
Yeah, so because we don't know what the source is, we don't exactly know. So here's what I'll say. One thing to understand, this parasite has a hard shell. Why is that? Why is that important? Because it's hard to penetrate and to wash off. It just protects itself. As a result, it survives on produce, and produce that has lots of crevices and surface area. So to answer your question, you want to avoid bagged salads or salad mixes and any other hard to wash produce that has crevices, broccoli, raspberries, produce like that. You want to stick to whole heads of lettuce where you can take the outer leaves off, or even better yet, produce that you can completely peel and cook. I do want to point out that microwaving is not as effective because of the uneven heating, and washing doesn't do a lot. You don't want to have unwashed produce, but it's not going to do a lot for you.
Okay, we'll do what we can. Keep watching this one. Dr. Archelle Georgiou, thank you so much for joining us.
Thank you.
Folks, we'll be right back.